So diabetes at 212 degrees, confronting an invisible disease. That was the title of my presidential address here at the American Diabetes Association. Diabetes is the epidemic of the 21st century. The numbers are staggering, the epidemic amazing, and yet it seems that the public, the governments of the world are not paying enough attention. Were it the Zika virus, was it an acute infectious disease, was it HIV, the government would be paying attention. The people would be taking this seriously. We're not spending enough money on the disease, on research to find a cure. The disease is invisible. The disease is invisible to everybody except that individual who has the disease. We have to turn the disease from a highly invisible disease to a very powerful and very highly visible disease. It is not, the diagnosis of diabetes is missed. The onset of diabetes is still missed, and there are still children dying of diabetic ketoacidosis. Almost 20 to 30% of all cases of diabetic ketoacidosis, of all children present in diabetic ketoacidosis, which still has morbidity and mortality associated with the disease. The diagnosis of the disease is often delayed, and several studies have shown an up to 6-year delay between the onset of diabetes and the diagnosis of the disease. Diabetes affects 30 million Americans, of which 90% have type 2 diabetes. A staggering 8 million Americans don't even know that they have the disease. Worldwide, diabetes affects 415 million people, and it is estimated that up to 46% of people worldwide do not know that they have diabetes. In Africa, the numbers are even more staggering, exceeding over 60%. So it is our goal to turn this disease from a highly invisible disease into a very visible disease. The amount of money that is spent at the NIH level pales in comparison to that which is spent per patient for other diseases such as cancer and HIV/AIDS. So it is very important that we turn the tide and that we increase the focus on diabetes.